Good afternoon, everyone, and thank you for joining us today. In the Legislative Building in Regina, we will have Premier Scott Moe and Dr. Shahab. Joining us over the line from Saskatoon is Scott Livingstone, CEO of the Saskatchewan Health Authority. This is a 2-minute warning. Good afternoon, everyone, and thanks for joining us today. Again, in the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab. Joining us on the phone line from Saskatoon is Scott Livingstone, SHA CEO. Both the Premier and Dr. Shahab will have opening statements, then we'll have time for questions. Premier?
Thank you very much, and good afternoon, everyone. I appreciate you joining us here today. Today we are reporting just one new case as well as 6 additional recoveries, which lowers our active cases in this province to 29. Just 18 active cases now in our far north and 11 in the rest of the province. There have been just 10 new cases this past week. That is the lowest number of new cases in any 7-day period since COVID was first detected in our province back in March. This is good news as we move into Phase 3 of the Re-Open Saskatchewan plan on Monday. Gyms will reopen. Restaurants will reopen. A number of personal services will reopen. So I would encourage everyone who is feeling well and is not immunocompromised to think about going out to your local gym or your local restaurant next week, and to continue to support those local businesses that are already open and already give back so very much to our community. This is how our economy will recover, and this is how we will bring back our jobs. Of course, everyone needs to continue to follow all of the good physical distancing practices that have allowed us to control the spread of COVID-19. But if you're able to do so, please go out and support a local business. Over the past few weeks together, we have proven that we can do both of these things at the same time. We can reduce the spread of COVID-19, and we can reopen our economy safely. In fact, even at the height of our restrictions, Saskatchewan had actually shut down less of our provincial economy than any other jurisdiction in Canada. Our job losses, while still very significant, were less than any other province in Canada. 87% of Saskatchewan workers were able to keep working throughout this pandemic. And now, with more businesses reopening, and even more people will now be able to return to work. Today, Statistics Canada released new figures for manufacturing exports. While Saskatchewan's manufacturing exports are down 8.2% this year, this is by far the smallest decline of anywhere in Canada. Quebec, for example, saw their manufacturing exports fall by 23%. Ontario is down 45%. And the national average decline is 35%. Saskatchewan's agricultural manufacturing exports are actually up 20% year over year. This is positive. So while every provincial economy has taken a hit, and we are no exception, Saskatchewan has been able to keep more of our economy going and more people working than any other province, while at the same time, we have been able to reduce the spread of the COVID-19 virus. And because we have been so successful in reducing the spread, I know there are many Saskatchewan people who would like us to reopen more quickly. I get those calls, I get those texts, I get those emails each and every day. So do all of our MLAs. I want you to know that we hear you. And I would like to reopen faster as well. And not just businesses, but also recreational activities and important medical services in our communities. And I know that everything that has been temporarily closed, whether it's a business or a school or an emergency room or a playground, this takes something away from the quality of life that we have and cherish and value so greatly here in Saskatchewan. So we are working very hard to reopen as much as we can, and we're doing so to reopen it as quickly as we can. But we need to do so safely because the COVID-19 virus has not gone away. So next week, we can expect a number of announcements with respect to several more reopening dates related to medical services, to schools, to beaches, to parks, and to playgrounds. We are committed to getting all of these things reopened as soon as possible, but as safely as possible as well. Today, we're also announcing the expansion of the Saskatchewan Temporary Wage Supplement Program to include a larger number of workers who are helping our most vulnerable residents and our families. The temporary wage supplement is a $400 a month wage top-up for up to 4 months that is already being provided to many lower-paid employees in seniors' care homes, in personal care homes, in community-based groups, group homes, in licensed child care facilities, in emergency shelters, in transition shelters, in integrated health centers, as well as to home care workers providing care to seniors in their own residence. The benefit today is being expanded to include anyone, regardless of their income level, who is working at a licensed public or private long-term care facility, which are under public health orders ordering visitor restrictions. We understand the additional pressure that has been placed on these employees because of the risk to our seniors, our family members in these long-term care homes, and because of the restrictions that have prevented family members from visiting and providing support as they normally would otherwise. Through this time, these workers have provided tremendous physical and emotional support to our seniors. Most importantly, they have provided our family members, our parents and our grandparents, they have protected them from the kind of devastating outbreaks that we have seen in long-term care centers in other provinces. They've gone above and beyond, and so we are providing this top-up in recognition of the great work that they have done and continue to do. In addition, workers at assisted living facilities, which also are under public health orders, can now receive the wage supplement if they earn less than $24 per hour and less than $2,500 per month. Workers at private daycares and approved private service homes will also be eligible. So I want to close by saying thank you. Thank you to all of these essential workers for all of the work that you are doing and for keeping our family members safe. I'll now turn it over to Dr. Shahab to make a few comments.
Thank you, Premier. So, as the Premier said, we look well poised to re-enter Reopening Saskatchewan Phase 3 next Monday, and look forward to several sectors reopening in the following weeks to months. But I think I just want to reinforce that it is going forward in a new normal, and this new normal will continue for the foreseeable future till there's a vaccine, so as long as June. So I think we need to just be comfortable that we are now engaging in more and more leisure activity and economic opportunities going forward starting Monday. But we really do have to pay attention to the guidance that is being provided by those sectors, gyms, restaurants, I strongly encourage people to take the time to read the guidelines themselves and understand what they are, so that we don't create a challenge in terms of not complying. Just like I said, when we were reopening phase 2, don't try 10 shirts on or 10 cardigans and then not buy any. Try to pick a shirt you want and bring it home and wear it and don't return it. So we need to support businesses to succeed, and retail. We have shown that you can engage in retail with no transmission. We've shown that over the last 2 weeks with phase 2 reopening, but phase 3 is more complex, and the guidelines are more complex. The way we are going to have to behave in gyms, restaurants, other sectors are more complex, and we need to make sure that we comply from our side as customers to make it easier for gyms to continue to operate safely. Because if we don't, and there's a signal of transmission, then that will unfairly jeopardize the whole sector, and we just need to work together to make that reopening phase a safe phase for all these sectors, restaurants, gyms, other sectors. And same with for personal care services. When you have to get closer to 2 meters, first thing is don't go to any personal care service if you're feeling unwell. Even if you have the slightest symptoms, which you may think is nothing, do not go. Rebook your appointment. Get yourself tested. Secondly, when you do go, if you have an option, wear a mask. If you're going to get services less closer than 2 meters, your provider may look very different because they may be wearing a mask and some eye protection. That is to keep them safe and to keep you safe. That's two-way protection because they will be using proper masks and eye protection. And I think if we just comply with these measures, as well as keeping 2 meters apart at all times, that will make sure that we can move forward safely. And finally, our gatherings, meeting within our virtual bubble, which now may include 3 to 5 households, 3 to 5 friends. It's really good to socialize outdoors when you can instead of indoors, and put a little thought to any social event you're having, some pre-planning, so that we can all do that safely, and especially protect those who may be more vulnerable. And don't partake in social events if you're feeling unwell, and think of getting tested. I think there's sometimes a bit of a pressure to go to that special event, even if it's small, because it was a long time planning. But even if you have even the slightest symptoms, it's better to stay away and follow up and get tested, because I think that will ensure that we can move forward with the confidence that we have engendered so far by keeping our case numbers low, but already engaging in a lot of recreational and business activity without case numbers going up. Thank you.
Thank you, Doctor. Thank you, Premier. We'll now take questions from the phone line. Operator.
We have Zach Becerra with the Star Phoenix.
Good afternoon, Premier and Dr. Shahab. I have a question for you in regards to protests in the province. Some organizers of upcoming protests in Regina have said that the notice sent out yesterday may have sent a message discouraging people from attending those protests. Are you advising that people in this province not go to such protests? And if so, how do you reconcile that with the right people have to civil demonstrations?
I would just make a short comment, and then I would turn it over to Dr. Shahab if he has any comments with respect to comments around the protests that occurred here the other day. I made 2 days ago when I was out here last. I will leave those to stand for themselves. But I do have concerns about any large gathering, regardless of the cause. From a healthcare perspective, this virus and how it spreads does not recognize the cause of the large gathering, whether it be a very good cause or whether or not be. It will spread regardless of the cause of the event. And we have, over the course of the last now 2.5 months, people in this province, families in this province that have foregone many large events, some of them at great personal sacrifice, I would say. I'm thinking of the memorial services for loved ones. I'm thinking of the worship services. I'm thinking of the weddings, other celebrations, family celebrations, community celebrations that have been foregone. People have made this sacrifice to prevent the spread of this virus. So I would just ask people in the decisions that they make each and every day, where they go, what they attend, to use very, very good judgment. to respect the public health orders that are in place, to abide by the physical distancing measures that are in place, because quite frankly, from a healthcare perspective, this virus does not distinguish why you are in or at the event that you were at, and it may not, the decisions that you make can not only keep you safe, but most certainly can keep those around you safe, your friends and family that you will see in the days after. Doctor, anything to add?
Yeah, I would just add that, again, from my perspective, anything that can be done remotely or virtually is better than anything that has to be done in person. I think that basic recommendation will remain as long as there's a pandemic in the world. And that is not going to end till we can enter phase 5, which by my estimation currently will not happen before June 2021. So this is a marathon. And there will be, unfortunately, many events where there's a compelling reason to get together, because that, as human beings, we always do. We get together when there's joy or sadness. And as the Premier mentioned, we have all had situations where only immediate family members went to a funeral and other close friends and family stayed away. So that's just my general message. And then when events are happening outdoors, and if there's a compulsion to be part of that, then again, there was some guidance issued yesterday that is pretty straightforward, that 2 meters is the absolute minimum. Staying even further apart is critical, and not handing things back and forth, and doing all the other things that are in that guidance around not chanting or singing, and using posters is important. If there is a compulsion to physically be at that place, there's been many things, prayer services, others that have happened virtually, and while some prayer services and other opportunities will be allowed from next week, many other events will still not be allowed. Many large events, sporting or cultural events, will not be allowed. And I'm not nowhere trying to make a parallel between protests against injustice and large events. All I'm trying to say is that those are the settings in which transmission can happen unnoticed. And by the time secondary transmission happens to household members who are at higher risk, sometimes it's too late to stop. And I think we all need to be very cautious and careful. And even if we do decide to go to such an event, I think you need to exceed the minimum guidance, not try to push the envelope. And I think that will remain critical over the next weeks to months.
Follow-up, Zach?
I do, yes. Police services in Saskatoon and Regina that we spoke to say that they prefer to take an education-based approach to this and not disrupt these gatherings or even be heavy-handed with the issuing of fines. Some police we've spoken to actually say they personally plan to attend these rallies. So how does this work, if at all, from an enforcement standpoint? And if these rallies are going to continue, can you maybe go through some of the things that people should be doing again, Dr. Shahab, to stay safe?
Yeah. So, and again, I'm not trying to say anything that I do personally speaks to what you should do at a rally or whether you should go to a rally or not. But, if you're out and about walking, 2 meters is the minimum. There's no harm staying 4 or 5 meters away. And if you meet a friend or neighbor and you want to talk, 2 meters is the minimum. Standing 4 or 5 meters away is better. So that's just something that, as you see people out and about, they can be, several dozen people out in a green area. But having more separation is important, not clustering together. Not, of course, even if you meet friends and relatives, or you are emotional because you're at a certain event, which could be a rally, which could be another allowed gathering, which will be allowed in the future for even up to 30 people, not feeling the compulsion to, physically engage with one another in sadness or joy, and not passing things back and forth. So I think some of those things, and of course, singing, chanting, all those things have been seen to cause transmission very quickly within a group, with resulting in hospitalization and deaths either within the group or in secondary household members who may be older. So I think those guidelines are there for a purpose, and if people do choose to participate, I think exceeding those guidelines and not trying to push the envelope is critical, because that's what we saw worked. the COVID-19 was flattened and it's at low transmission levels, not due to some high-tech technology. It is due to simple measures that all of us took by maintaining physical distancing, by attention to cough etiquette, hand hygiene, but not participating in a way that we're handing things back and forth. And I think those same principles we need to follow going forward.
We'll take the next question from the phone line, operator.
We have Adam Hunter with CBC.
Hi, I'm wondering if we can get a clearer timeline on Phase 4 timing. A lot of sports and camps are looking to make plans. They don't have guidelines on which they can even plan right now. So do we have a date on Phase 4 timing, and will there be guidelines sent out to some of these sports and camp organizations that are looking for some parameters on which they can operate when they're allowed to?
The timelines will be released very shortly, not today. And I would just say that the work with many of these organizations in Phase 4.1 is occurring right now, has been occurring for some period of time with respect to the parameters of how they will be able to operate, and we'll make that available to them at the first opportunity. Dr. Shahab, if you had anything to add on the consultations that are going on with respect to Phase 4.1.
Yeah, so again, Phase 4.1 will include child and youth day camps, outdoor pools and spray parks, and other recreational outdoor sports and activities. And again, the timelines would likely be firmed up next week, along with some initial guidance, but then that guidance will be further developed over the next coming 1 or 2 weeks. And then Phase 4.2, that is going to be later than that, which includes possibly indoor pools, indoor rinks, libraries, museums, galleries, possibly movie theaters with some specific considerations, and casinos and bingo halls. That'll be at a later date. And we have said in the past that we like to give 2 to 3 weeks at least between phases, maybe up to 4 weeks. So that gives a ballpark estimation of when Phase 4.1 will happen, and then maybe another buffer of at least 2 to 3 weeks for some, if not all, things under 4.2. But again, the detailed guidance the details will be provided over the next 1 or 2 weeks. And I also have to say that if you look at other European countries, obviously some countries have opened up more quickly than others based on their own epidemiology, but we are going really fast. And in North America, because we really don't always have a national approach, we have a provincial approach, which is based on our own epidemiology and context, and that's fine. But even if you look, to our neighbors, there's some variation. But I think we are certainly going in a systematic way. We're trying to be cautious, but not at all slow, and trying to, engage in everything we can in a systematic way with clear guidance that all of us should be familiar with. And we think this is really important for us to continue to move forward while keeping case numbers low.
Follow up, Adam?
Yeah, I'm wondering what Dr. Shahab and Premier Mo have to say about the guidance being given to all the Crown employees that may be heading back to work in Phase 3 and 4 into office buildings. First to Dr. Shahab, what's your guidance on people working from home versus working in an office? Should they stay home if they can? Should their employers keep them home?
Yeah, so again, where you can work from home, that is a better option. And so there's some sectors where obviously you can't work from home, and that's all the essential industries that kept going. But even there, we have learned a lot from how they were able to continue in a safe manner. So you could have significantly large numbers of persons at a workplace, but the shifts were staggered so that lunch breaks and other breaks were staggered in a way that you had less crowding in the lunch areas. You had protocols where you had greater attention to hand hygiene before and after using the washroom, before and after eating. The way people are behaving, keeping physically distant, not sharing snacks or other food items, the things we take for granted with our second household, which is our workplace. We were not that certainly you shouldn't really treat your workplace as your virtual household. You need to keep that physical distance, because if you don't, COVID spreads to many households. And even though cautions applied in essential industries, we had small clusters, but because people are doing everything they had to, those clusters were kept small. So the same principles we will have to do as we re-enter workplaces and crown corporations, other industries that some, if not many employees may continue to work remotely where that's productive. Some may have to go back to work but behave very differently in terms of not just how they work, which in many cases you can organize in a way that's safe, but how you behave during lunch breaks and how do you socialize in a safe way with your colleagues. And I think all of that needs special care and attention.
I would just add to that, Adam, whether you are able to work from home, and many will be able to do that for the next while. Some may do it for on a permanent basis, or whether they are required to come back to the office as a full-time or come back to the office for a number of hours a day or possibly a day or two a week. Employers and employees will be able to work through that. Dr. Shahab has mentioned that there needs to be a new normal that we operate under, whether it's in our retail business or whether it's in an office setting. We're currently working through what a plan would look like for bringing back many government employees that are working from home, ensuring that we are there will be bringing some back, but some will continue to work at home for a period of time. But it's also important for us to remember as we go through the next number of weeks that throughout this pandemic, 87% of the people that are working in this province have continued to work throughout this time, and we have been able to control the spread of this virus. Now, many of them, yes, have been working from home, but many have been working in a very, very different environment, a new normal, if you will. There's been some other challenges that have arisen as we go through the phases of reopening that other 13% of the jobs in our communities. Challenges, for instance, with respect to childcare, and I would just say again that we continue to have about 50% of our childcare spaces that we had allotted for people that are going back to work are still available. We have about 1,100 childcare places that are open, and people can utilize those for a period of time if they're going back to work and need some options or access to childcare. So there are options and supports in place as families do return to work. But we must also remember that the vast majority of the jobs in this province have continued, albeit differently, throughout the entire last 2.5 months where we have been working our way through this pandemic.
One thing I just want to say is that right now, because virus transmission is low, we can be confident going back to work, but there should be confident optimism, not complacency. And everything we need to do in the new normal, we need to bake that into our almost subconscious memory, so that if and when we see a second wave or whatever in the fall, we have the protocols in place so that in most situations, we will not have to go back into lockdown. Because we have made the way we work at the workplace so ingrained that it is safe and maintains the physical distancing, maintains the hand hygiene, the cough etiquette, staying home if you're sick, working remotely where possible, that will allow us to continue operating if we get a cluster or local geographical increase or a second wave, with minimizing the disruptions that we had to take place in March, April, because at that time we had not learned everything we know now. But I think summer is the opportunity to really ingrain that at a fundamental level in our work environments, so that if and when we do see an increase in transmission, for the most part, that should not result in increased risk in the workplace, because we're already operating in a very different way while being productive.
Take our next question on the phone line.
We have Murray Mandrick with the Leader Post.
Good afternoon, Premier Dr. Shahab. Many parents I'm communicating with still do not understand why playgrounds, sporting fields for at least informal activities can't be open in phase 3 if we're going to be opening churches, if we're going to be doing other things where there's going to be this exchange anyway. They feel for whatever reason that children are being sort of singled out and unfairly because right now they've been off longer than they actually would have been for summer holidays. So can you offer some level of explanation as to why we're not at least considering early opening of playgrounds?
I would just quickly say that we've heard those same concerns, Murray, and we're working very hard on how we would be able to work with organizations to ensure that we can open these facilities for our children sooner rather than later, as well as, and we'll have more to say on that next week, as well as some more direction with respect to the school year and a number of other facilities that we've been working very hard on with individuals and organizations that have been raising these concerns with the government, raising the concerns also with Dr. Shahab's office. But you want to comment a little bit more specific to playground equipment and children's activities?
So I think some of the worship places and other settings, they will have very clear guidelines and people who will be monitoring how people enter and sit, and so they'll be supervised. A lot of play structures, other settings, while they're safe because they're outdoors, it'll really have to be, and that guidance will come in terms of an earlier reopening date compared to phase 4. But there'll have to be some awareness in parents in terms of how they need to supervise children and keep children home if they're unwell, and accept some low level of transmission risk in those outdoor environments, which are low risk as far as we can see, and especially currently with low COVID transmission. But there needs to be some oversight in terms of how children engage, in terms of reducing crowding and hand sanitization before and after using structures, which really you can't expect municipalities to sanitize them in any meaningful way on a day-to-day basis. So I think that's where some thought will have to be given for outdoor structures and other playground activities.
It's a good point, Murray, because Reopening Saskatchewan is not just about reopening that 13% of our economy that has been on pause over the course of the last 2 months. Reopening Saskatchewan also includes their extracurricular activities that we and our children take part in. And I would just say to the parents that have concerns around children activities, organized sports and things, that we most certainly hear you, and we're working very hard to come up with some parameters where we can safely get our kids out and get back to a new normal, if you will, in our communities, not just from an economic perspective.
Follow up, Murray?
Yeah, I guess what I'm getting back from parents is they want a parent. Their rebuttal is that, well, the weather's getting warmer. We're told that stops the spread of infection, that they can properly monitor the number of kids on the playground effectively themselves, that they can do these things as parents themselves. They truly don't understand, I guess, the messaging when we're seeing so few cases, 2 in the last 3 days, I believe, of new cases happening right now, why they can't be entrusted to allow their kids to have some activities that they need to have, obviously. So can you better explain why playgrounds at this particular stage would be all that much of a risk compared to anything else?
We're hoping they will be. We will be able to come up with some safe parameters for our kids to partake in some of these activities. I would just go back to by far and away the largest reason that our numbers are good is because we have been so very careful as individuals, and we have taken the precautionary measures with respect to the size of gatherings that we are attending, with respect to what we are touching, our sanitary practices. That is why we are having success here in Saskatchewan, is because of the choices that we are making as individuals, and we hear the concerns of parents with respect to playground equipment. For example, we're hearing we're hearing the voices of parents that want some certainty with respect to whether or not there's going to be a school resuming here this fall. So we're working very hard on what safe parameters can be for playground equipment, for organized sports. We want parents to be parents. We want that to happen sooner than later. Doctor, anything else on that?
Yeah, and again, I don't want to preempt the guidelines, but we can all understand that now 3 to 5 families getting together on a regular basis, or 3 or 5 friends or playmates now playing mostly outdoors, cycling or playing something together, the soccer or other sports. That's one thing, because it's always the same 4 or 5 friends, and if there was a rare event of transmission, you can quickly trace who those 5 or 6 were. But as we look at sports camps and other things, I think the same principles will have to apply, that you do it in a way that you can quickly identify who were the group of 10, 15 individuals who you interacted with as you re-entered training for sports or re-entered sports activities. because the risk does go up a bit. The risk is lower outdoors, but not zero. But you still want to make it manageable and still reduce, uncontrolled mixing at any age group, where if you do get into a transmission situation, there's potentially many more people who you can't even trace. And I think that's some of the challenges that we need to look at as we move forward cautiously. But I agree that summer is a time to enjoy outdoor activities, and we need to move faster on some of these areas.
Next question on the phone line.
We have Kayleen Swatsky with Global.
Yes, hi. I'm going to go back to the parks and playgrounds for just a second. I understand that the parameters are forthcoming for these, but what is your response to some that are saying that it's taken too long for the provincial government to consider and factor in children and their needs into the Re-Open plan?
I would just point to the success that we are having in this province. And if you look back just not that many weeks ago, we were experiencing some of the highest numbers that we'd had to date in certain areas of the province, and still really managing our way through what guidelines with respect to a Re-Open Saskatchewan plan would look like. So we've been working with people that have raised just these types of concerns with us on how we can move forward, but move forward safely, because the spread of the virus is still there. And we have been fortunate in this province, not by accident or luck. We have been fortunate in this province by the guidance of our Chief Medical Health Officer, but just as importantly, the decisions that individuals have made. They speak to our collective success, and you don't have to look very far outside of our provincial borders to see some of the challenges that this virus is presenting. When you look across Canada, the number of cases per million people is just under 2,500. We're about 550 here in Saskatchewan. When you get to a much more alarming number, the number of fatalities per million people, the Canadian number is over 200, 201 fatalities per million people. We're at 9 in this province. Far, far lower than the Canadian average. And so we may be viewed as moving a little slow on a few items, but we need to ensure that we are moving safely. We need to preserve these type of very powerful stats. These are not stats, these are people. And we are in a very positive place here in Saskatchewan. We are doing everything that we can to open up, yes, playgrounds, open up the other sectors of our economy. We want to get people back to work. We want to get people moving into what is a new normal, and there's no better time to do that when the weather's beautiful outside and it's summertime. And we're working feverishly to ensure that we can have these parameters in place so that families can enjoy this summer, so parents can get back to being parents, so kids can get back to being kids under whatever this new normal is. And we will endeavor to bring forward a number of these parameters likely early next week.
And I'd just like to add that if you look at our use of green spaces in Saskatchewan within cities and municipalities and others, I think Saskatchewan has been blessed with lots of green spaces. And apart from the play structures itself, we have always encouraged outdoor activities even in March, April as the weather improved. And we have seen initially immediate households enjoying the outdoors, and now groups of 3 to 5 households, 3 to 5 playmates as children enjoying outdoor spaces, whether they're biking or partaking in other activities, unstructured play that's very good for childhood development. So we have already seen that, but I think the remaining concern was just around multi-touch services like play structures that we just need a bit more thought. But I think we are at a time with very soon, we can give some very high-level recommendations around parental supervision, especially for younger kids, and that can move forward.
Follow-up, Kayleen?
Yeah, Premier, you've touched pretty heavily on the successes that Saskatchewan has seen and that you want to get the province back open. There's no better time to do that, but then why was it decided to further stagger the Re-Open plan into splitting Phase 4 into Parts 1 and 2 instead of having that phase roll out all at once?
The guidance of our Chief Medical Health Officer on the risk of the various items that we have in this particular phase. As we had put forward the Re-Open Saskatchewan plan, we had always said that it is a guideline or a framework, and we will be refining it as we go along, and we have included a number of additional activities and sectors of the economy that were not in the original plan as we go. So this is being split into two on the advice of our Chief Medical Health Officer and health officials. And we do want to move on those sectors of our opening our community and our economy as soon as possible, and we don't want to hold up some sectors because there's still maybe some foreseen risk in some other sectors. The success that we've had in this province when it comes to hindering the spread of COVID-19 is very real, and I just can't thank the people of this province enough. We're 78% below the Canadian average when it comes to COVID-19 infections. More importantly, we're 95% below the fatality rate in Canada. These are tremendous numbers. We still need to be aware that this virus is still here. Just today in Quebec, we saw 91 deaths. In Ontario, 45 deaths. We're very fortunate in Saskatchewan that we do not have a fatality today, but this virus is not very far away, and it can come back at any time, and that's why we need to ensure that we are reopening as soon as possible, but reopening as safely as possible.
We'll take our next question on the phone line.
We have Lisa Schick with CJME.
Hi. Some people have been asking whether the worship guidelines for the next phase extend to services like funerals, because if they can have 30 people in a church for a Sunday service, then why would there only be allowed 15 people at a funeral just a few days later?
So we can get some specific information on that, but I would agree that you can have indoor or outdoor or special events now in a safe manner that complies with the capacity of that facility. But thank you for that comment, and we can get some specific information out. And again, what we have learned from both, the retail sector, but now with gathering sizes and the allowance for worship services, is that depending on the size of the building, you can have things that, as long as people maintain that physical distance, as long as there's sanitation or multi-touch services, and as long as people can stay within groups, that if there was transmission event, you only have to reach out to 15 people who are within a certain group, and then there may be another group that's in another room or another part of a larger hall. I think those are the principles that have served us well in the past, and those are the principles that we need to continue to embody as we move forward to prevent large transmission events which can quickly spin out of control, and that's what we need to avoid as we move forward. But we will get some specific guidance on that point. Thank you.
Follow up, Lisa?
Yes, Dr. Shahab earlier said that we're moving fairly quickly in reopening compared to other jurisdictions. There are those in the province who feel like we're not moving quickly enough, that we've had such low cases, and they're saying, we never actually got to the number of cases that had been, I guess, in the modeling that had been the worst case scenario. So they want to move quicker. I guess, Premier Dr. Shahab, what would you say to that?
I can speak.
Go ahead.
No, what I was trying to say is that if you look at many European countries, they have national guidance that is very conservative and very cautious, because they take into account of all contexts, large cities, rural areas. In Canada, we obviously, each province is looking at what pace they want to follow based on their context. So based on that, we have been able to, in my view, reopen fairly quickly based on our case numbers. And we have to remember that the Re-Open Saskatchewan plan was designed in March, April, when we were just actually, our case numbers were going up. So we had to conceptualize a plan while our case numbers were going up. There was a lot of uncertainty. We learned a lot over the rest of April and May about what really controls the spread of COVID. And it was very reassuring to see that actually our own personal actions, all of us behaving in a certain way, actually controlled COVID. Again, not a high-tech solution, but the goodwill of all of us behaving in a certain way to keep ourselves and each other safe. So that knowledge was then applied to refine the reopening plan guidances. And like I said earlier this week, it allowed us even to increase our outdoor gathering limit from 15 to 30 in phase 3, which really we had thought wouldn't happen till phase 4. But having said that, I think as we move forward fairly quickly and even compress some of our dates. And again, I do want to clarify that initially we thought we would give 4 to 6 weeks among phases, but we have compressed that to at least 2 to 3 weeks with the confidence we've engendered. But that confidence shouldn't turn into complacency, and I think that's really important. We can't really become not as careful as we've been so far, even as our case numbers are low. So that same thoughtfulness that we've shown to each other when we're out shopping must continue when we're using a gym or a restaurant, and we must follow the guidance that's there for everyone's benefit and not see that as a restriction that a business owner is placing on us and have a bit of a back and forth about why I can't pull 2 tables together and this and that, because that same thoughtfulness will ensure that we remain safe as we move forward.
I would just add to that, Lisa, there's really 3 points to reopening Saskatchewan. The first is our economy, and I think it's important for us to identify and recognize that we didn't idle the economy down to zero. In fact, in Saskatchewan, we idled the economy to the very minimum. In fact, we led the nation in only pulling back about 13% of the jobs here in Saskatchewan. 87% of the people continued to go to work throughout this pandemic, and we were able to control the spread of this virus. Our export number is out today, although we're concerning with a reduction year over year of 8.2% in exports, and that is what drives our economy here in Saskatchewan. When you look at other provinces such as Quebec down 23%, Ontario down 45%, again, we led the nation in our export numbers here today. With respect to our community, we've been working very hard on reopening sectors of our community, and we're talking today about children's activities, playgrounds, and such. I've been working with our faith communities of all faiths on worship services. We'll have more to say on the playgrounds in the days ahead, as well as beaches and ultimately providing some direction with respect to the next school year. Last but certainly not least is with respect to reopening our healthcare system here in the province. And the Saskatchewan Health Authority has been out on a few different occasions and is re-engaging actively in our surgeries. And it's important to remember that we did not go to zero with the surgeries that were being performed here. In fact, we've already have started that reopening and are actively working on that. We will have more to say on the advancement of reopening our healthcare sector next week as well. But we are up and over 40% of surgeries are occurring here and continuing to increase those in the province. So it's reopening multiple sectors of not just our economy but our community. But it's also important for us to recognize that many of these sectors were not set back to zero, but they were some of the higher risk areas were pulled back. And now with phase 3 occurring on Monday, we are essentially, with respect to the jobs, reopening the vast majority of the sectors that include that 13% of the workplace that was not able to attend over the course of the last 2 months. Now, we need to increase our economic activities so that all of those jobs can come back. And I would just encourage people in the days and weeks ahead to go out in their community and enjoy a meal at their locally owned restaurant, to enjoy and to purchase some items at some of the locally owned businesses that for so many years have supported your community and your kids' activities and really been there for us when we needed them, and they need us now. So I would encourage everyone to go out and support their local businesses and their community in the days and weeks ahead.
We'll take our next question on the phone line.
We have Cole Davenport with CTV.
Hi there, good afternoon. Is the government considering students returning to classrooms in September, and what kind of direction is being given to school divisions, teachers, parents, and otherwise about preparing to have those students back in classrooms?
And this is work that's actively being undertaken. We'll have more to say on that very early next week.
Follow-up, Cole?
All right, and specialized services for people with autism and developmental disabilities have no date to reopen. How can you justify allowing hair salons, for example, to reopen, but not services for kids with autism?
We can get some further details.
Yeah, we'd have to get a little bit of further detail on that. I know From an education perspective, Gord Wyant, Minister of Education, has been doing some work with respect to these individuals, and I don't have the answer in front of me with respect to the healthcare services that are being offered, but we can follow up and provide you with some clarification on that, Cole.
And we'll take our last question from the phone line.
We have Alicia Bridges with CBC.
Hi. I have a couple of bigger picture health questions. My first is just beyond what is happening at the University of Saskatchewan, what is the province doing to ensure access to a vaccine once there is a vaccine candidate? What work's being done to prepare for that and to make sure we have access when it does happen?
Well, we've advocated, I'll speak at a high level, Doctor, and if you want to add to it, but we've advocated very aggressively with our federal government on behalf of Vito Intervac in Saskatoon that is doing some tremendous work in this area, not only on their own vaccine that they are developing, but also on partnerships and that they have with other world-leading vaccine researchers around the world, and there are a number of vaccines that are being worked on around the world, and not only is Vito Intervac being very active in what we believe will successfully be the approval of their vaccine, but they will have access to others as well. What we invested in many millions of dollars alongside the federal government was not only in that vaccine research, but in a production facilities to ensure that when either Vito Intervac comes up with the approval of their own vaccine, or B, someone else does whom they have a partnership with, that they would be able to access that vaccine, ultimately produce it right here in Saskatchewan for the residents of this province as well as other Canadians. And I would take this opportunity to publicly thank the federal government for their in excess of $40 million investment that we have added to with many millions of dollars from the provincial government, over $4 million from the provincial government, not only in the vaccine research, but in the ability to produce the vaccine upon having an approval. So, Doctor, anything to add to that?
Yeah, I would just add that as part of pandemic preparedness, we are actively engaged with the federal government that if and when a vaccine is available, we would be able to deliver that in a systematic way, and we will build on our two areas of success. The first area of success was that in 2009, when the pandemic started in April, we had a second wave in summer, July 2009, and then our third wave in September 2009. We had the vaccine available by October, and we were able to, in a systematic way, deliver a vaccine to anyone who wanted one. It was an optional vaccine, and half the population chose to get the vaccine, and we had one of the highest vaccination rates in Canada, if not the world. And it was done in a very systematic way, so we will build on that success. And secondly, we do give the flu vaccine to around more than a third of the population every year, and we, over the years, have expanded the number of colleagues who can vaccinate, pharmacists, public health nurses, physicians, and we will build upon that capacity to deliver the flu vaccine, which we will, of course, deliver this year as well in October, to be able to quickly deploy and administer a COVID vaccine if and when it's available.
I'd just add to that, Alicia. We've been very, this government has been very bullish, if you will, on international engagement. And much of that discussion stems around the need for us to have relationships with our international partners from an export perspective, as this is how we create wealth in Saskatchewan, as we export goods that we produce, manufacture, or harvest. There is another important aspect to the international engagement that we do and will continue to do post this COVID pandemic. And I would point to our most recent engagement in South Korea, where, yes, we were working with agri-food purchasers. Yes, we were working with those that may be interested in other products from Saskatchewan. But we were also witnessed a signing of a memorandum of understanding between the University of Saskatchewan, more specifically Vito Intervac, with the International Vaccine Institute on exactly this type of information sharing. And this is an organization that is doing some work with respect to a COVID-19 a COVID-19 vaccine program. So the international engagement that we undertake is not solely focused on the economy, but it's also focused on advancing the knowledge-based institutes that we have at our two universities, Saskatchewan Polytechnic, as well as in the private sector. And I just point to this as being an opportunity that Saskatchewan is realizing, not just from that engagement in South Korea, but by international engagement in general, is to have these partnerships so that we can ultimately not only prosper economically, but also prosper when it comes to accessing things such as a COVID-19 vaccine.
Do you have a follow-up, Alicia?
Yes, please, and thank you for that. My next question is in regards to treatment. I'm just wondering what type of medications and treatments are being tried, experimented with, or used for COVID-19 cases in Saskatchewan at the moment.
So at risk of seeing other politicians in North America being dragged over the coals with their comments on different treatments, I will turn that over to my much more knowledgeable friend.
So we can get details of specific trials, but our clinical colleagues in ICU, respirology, and infectious diseases, they are participating in systematic application of approved treatments for use in Canada, but they are doing it as part of clinical trials because, again, what we know is prevention is key. More than 80% of people have an illness that can be safely managed at home. People who require hospitalization need excellent supportive care that they are getting either in an acute care floor, which may include supplementary oxygen, or within an ICU setting where Dr. Susan Shaw may be on, or Scott could add to that. But really, the bulk of the effective clinical management, even within a hospital ICU setting, is excellent ICU care or acute care, which is for the most part supportive. That includes where required oxygen and ventilation and other supports like dialysis and other multi-organ supports. And that has shown its results in Saskatchewan that with around 51 hospitalizations, 15 plus ICU admissions, our mortality rate has been low and certainly not on the higher end compared to other parts of the world. So the clinical care is based on excellent ICU care and acute care that for the most part is supportive, but the use of clinical treatments is done in a systematic way as part of clinical trials so that clinicians can learn in real time about which additional treatments may or may not show benefit. And I'll maybe just pause to see if Scott or Susan are on to add further to that.
Susan's not on, Dr. Shahab, but I would just reiterate for Alicia that we can certainly follow up with the clinical teams on your behalf and give you an idea of what type of clinical trials they're participating in actively. But as Dr. Shahab has said, most of the work is being done around supporting patients in higher levels of care. It's not always directly related to drug treatments, but more supportive care.
Thank you.
And that concludes our time for today. For those that are on the line, we are not planning on holding a press conference tomorrow. We will have COVID-19 case updates as per usual tomorrow and through the weekend, with our next regularly scheduled press conference on Monday, June the 8th. Thanks very much for joining us.